So today we are rolling through this last part of our study guide, talking about birth control, talking about STDs or STIs, sexually transmitted infections. They don't call them a disease anymore, it's just simply an infection. But we'll start with birth control. We've already talked about the rhythm method. Rhythm method simply being the woman being very aware of when she is ovulating, whether it's simply just keeping track on a calendar, whether it's using the ovulation tests that you can buy, which is a fairly expensive way of doing it, but you could do it that way. And then avoiding sexual intercourse during that time. The theory behind it being if there is no sperm to meet the egg, there are no babies that can be formed, right? How well it works, efficacy rate is what they call that, how well this form of birth control works, it's fair, okay? Maybe a 60%. Why would it be so low? Thoughts? Sir? Everyone's different as far as what? Fertile, right? How long the egg is present, right? When it's released? Sure, all those things. Good. Why else would it not work? Or might it not work? Okay, sure. So there's variance in the amount of time frame we have. Good. Why else? I'm thinking way more general here, guys. Okay. I mean, you have to avoid sex for this period of time, right? And it kind of cramps your situation, right? Cramps your style, right? You know? Right? Yeah. You know? So but again, this is a huge deal, right? Because realize, what did I say? When is the point that the woman is most interested in having sex? When they're ovulating, right? So again, you're kind of trying to go opposite of what your body is hormonally telling you to do. Does that make sense? Which can be difficult, right? So certainly not the best method. Well, we'll talk more about that when we finish the list. Coitus interruptus, nice Latin name. Coitus meaning sexual intercourse. Interruptus meaning interrupting, stopping, right? So this is the thought of that I will, if you're having intercourse, you'll pull out. The male will pull the penis out and ejaculate outside of the vagina. That way there won't be any, theoretically, won't be any semen that gets into the vagina. There won't be any sperm that can meet the egg, right? Difficulties with this. Tough to do that. To know exactly when that's going to happen and to have the mental capacity to do that, because that's not really what you're thinking about at that moment, You have to deal with the semen, and some people that would not be something they would be interested in being a part of. Now it's out. How do you collect it? What do you do with it? Is it getting all over the place? Are you with me? Being real, right? Okay. There is the potential that during some of that, the lubrication that comes initially, right? Remember from the bulbourethral gland is releasing this lubrication for the male. There can be some sperm that is involved with that, okay? In this fluid that's coming out before the majority of the semen with ejaculation. So there could, even though you pull out at that moment of ejaculation, there could still be semen that gets into the vagina, right? So, again, not the best of methods, okay? But again, the point of both of these, why do we do these, is because you don't need anything to do them, right? There's no external barriers. You can have sex in the normal way. It's just that there are these small little things you try and do to prevent the pregnancy. You with me? But there's no gels, there's no condoms, there's none of these kind of things that you need to do them. Does that make sense? Okay, condoms, male and female condoms is the next piece where we are. Looking something like this. I have my bag full of birth control. Isn't that exciting? Show and tell today. Show and tell. Here we go. This was a kind of an awkward conversation having with the folks at CVS. Here, I'd like to purchase all of this birth control. No, I mean, but I need it all. No. Yes, right. No, I'm a science teacher. It's all good. It's all good, sir. It's all good. you can try that line. No, it's strictly for research purposes. Research purposes, yes. Okay, so the male condom. There's a male condom on top. Certainly the most common form of birth control used is the male condom. This is a female condom. I don't even know if you all knew that there was such a thing as a female condom. Working the exact same way, right? That you have this, and I even brought our banana to stand in for us, right? It's rolled, right? So you can see on the end that there's this little opening area here, and so you simply put it on and you roll it down. And it goes as far as you need it to go, right? Some of us longer than others, but it's there, right? And therefore, and this is done before. You have to understand this. This is done before. Hang on. Obviously, it's before ejaculation. Obviously. I'm saying before there's any sort of intercourse, you would do this. Because remember that any of those fluids that come from the penis could potentially carry semen, right? I mean, sperm, not semen. Could potentially carry the sperm. So the point is that you are encapsulating the penis in this sheath of rubber and then collecting any of the ejaculate that comes out, right? Following the intercourse, you would then remove that and you just simply throw it away, right? As a barrier, very safe, okay? Because not only is it going to collect that semen, but it's also going to help prevent it against STDs, which we'll talk about that in a minute. Because none of my fluid as a male is getting into the female. None of the female's fluid is getting into the male. Are you with me? Now, if there are other types of sexual activity you are doing, you are still exchanging fluids, right? But at least on the genital level, this is not happening. Okay? Simple to use, easy to use, cheap, right? It doesn't cost a lot. You can buy 100 packs of condoms. I don't know who needs a 100 pack, but you can get them, right? Costco brand condoms, right? Okay, there you go. Crooklyn's good stuff. Okay? This one, I don't know if you can see on my fingers here. This actually is a combination because the best way of doing these things is to make a combination between a couple of different birth control methods. So you have the condom, but this also has a spermicidal jelly that's on there. So it's a lubricant, which is always a very good thing. But the point of the spermicide is it kills sperm. Like that's its job. It literally destroys the sperm, right? So that if you have this combination of the barrier plus the spermicide, your chances are pretty low that you're going to get pregnant from it. Does that make sense? The only way something like this would not work if you didn't put it on right, or you put it on too late, right? That there was some fluid already came out. Or if it tears, which does happen, but it's pretty rare. Okay? So you're talking about 97, 98%. I mean, these things work very well. Do people occasionally get pregnant from those other things going wrong? Yes. But for the most part, this is a pretty solid way. Drawbacks? Well, you're in the course of your romancing this person, and you have to pause. Okay, let's put this on, right? So that kind of interrupts your flow, interrupts your swing, you know? Some people don't like that. For the guys, it does decrease some of the sensitivity, right? Because now you're taking this organ, the penis, that's very highly innervated, right? Lots of nerves, and you're covering it with this rubber sheath, right? And so that some people don't like. Does that make sense? But again, it's all a matter of you're weighing these different, what's the word I want? Pluses and minuses. Okay? This that I'm showing you here, well, actually, this was the contraceptive gel. I apologize. This has contraceptive gel here, but this is also a diaphragm. So we're here, just so you understand where we are. Male, female condoms, diaphragm, cervical cap. So what this is, and that's what this guy is right here. You remember where the cervix is, right? I'm going to put this down. I've got stuff on my hands here now. You remember the cervix, right? The cervix is this opening right at the bottom of the uterus, right? And you remember that it has this kind of bagel, kind of donut shape to it. So a cervical cap simply is a plastic piece that fits right over that. And the point of it is it's blocking the route of the sperm to get up to the egg, right? This would again be something that would have to be put in before any sort of intercourse. It can stay in for a decent number of hours. You wouldn't leave it in overnight or anything like that, but it can. It's not like you have to be in the midst of intercourse and saying, no, wait, pause, let me put this in. Where the condom, there is more of that, less spontaneity to it. Does that make sense? Oftentimes it's used with a spermicidal gel as well. Again, combining two different types of birth control together, which, again, is always a good thing to do that. This would not protect you against any sexually transmitted diseases, right? Because you're still allowing your fluids to get to the guy and the guy's fluids to get to you. You're just simply blocking it at the entrance to the uterus. Does that make sense? But the semen is still in the vagina. Any questions here? You guys are like almost in this stunned silence. Good. All right. Old school. You know this stuff. Easiest to mistrust. We already know all this. You're just rolling through. It's fine. It's cool. Birth control. This would be on your list as listed as hormonal contraceptives. And there's a whole range of ways you can get these into you. Orally, taking the pills, injections, a patch. Sometimes it's a monthly thing. Sometimes it's every 3 months. There's a whole range of ways you can do this. Yes? So it would be like literally like a patch that you put on your body that has the medication in it, that it gradually releases it over time. Yeah. Yeah, like the nicotine patches. If you know what I'm talking about with that, but this is a medication patch. Yeah. The benefits of something like that is you don't have to remember to take a pill every day, right? Because the oral hormonal birth control is certainly one of the more common for females. Okay. This, you take a pill every single day. The hormone levels change. Like the first week of the pills, it's this amount, and the next week it's that amount, and the third week it's this amount, and the fourth week is just a placebo pill that you just take to keep you in the habit of taking pills every day. Because that fourth week is your period. Are you with me? And then you start cycle over again. And what this does is it basically tricks your body into not producing that significant amount of endometrium in the uterus, right? So that way, if an egg and a sperm get together, they can't implant and begin to grow a baby. They'll simply be flushed out with your normal monthly flow, which is lessened. That's one of the things that even people who aren't sexually active, women will take birth control because it helps regulate their cycles. It makes the flow not as large, the cramping and some of these kind of things not as much. For many women, it doesn't do the same for everybody, but for many of them. So it is something that is taken just simply for that. There are some dangers with it long-term wise. You don't want to be on birth control, on hormonal birth control for, say, 20 years of your life, because it can cause other issues as far as some cancer difficulties and some hormonal difficulties over a period of a long time. Does that make sense? So it is certainly something that people do use for a period of time, but it wouldn't be like your go-to for the rest of your life kind of thing. very inexpensive way of getting birth control. You can get this for free, even. Every county has clinics that you can go to, and you can get this for free. My wife and I, when we first got married, that's what we did. Because we had no insurance, right? We were a bunch of college students who got married, right? But you can get this for free. So you have to go and you see a doctor, and they'll give it to you. It's really very easy to get. So, any questions there? Will this protect you from sexually transmitted diseases? No, would not. Because again, all this is doing is simply not letting the egg and sperm implant, so it's not gonna affect that at all. Yes, sir.
Is there anything that could protect you from STIs?
The best protection, well,
I mean, like,
condoms would be the best as far as these kind of birth control methods we're talking about. Yes, because the point of these is it doesn't let the fluids get together. You know, your fluids stay in you and her fluids stay in her, and life is good. Those are the best as far as that goes. Yeah, what's that?
With the, you said the 4th week of the pill is the placebo effect. Isn't that essentially the same as the Lincoln method?
No. What I'm saying is there aren't hormones that are in those 4th week of pills because it's not needed. Like the body is flushing out that endometrium during your period, so the hormones are not needed to do anything at that point. It's just during the first 3 weeks that it's helping. They give you this other pill just so because you get in this habit of taking a pill every day. And so they don't want you to go for a week without taking it, and then, suddenly it's 2 or 3 days into the next week and you've forgotten to take a pill, and you might get pregnant. So there is some rhythmness to this, you're correct. You know, that it's basically regulating your cycle into this 4-week span, and, life is good. So it's a little bit of a combination of both, but you know when it's going to happen. Like it's very obvious here is when the ovulation occurs. This doesn't prevent ovulation, usually. It does not prevent ovulation. It just won't let them implant. You had a question, Mariah?
How does this
So this would be inserted into the vagina. This end piece is like a diaphragm, like a cap that goes over the cervix. And then you would have intercourse, and then afterwards you would just remove this the same way you would do for the male condom. Yeah, no, it is. You're right, because it's not. I mean, the male condom is covering an organ, that's not going to change, whereas this is covering a space. You know what I mean? So yeah, no, not nearly as good, but it is an option. It is an option. Sure, most of these you have lubrication that are combined with it, a spermicidal lubrication that are combined. You would want to make sure. I mean, like, so here on my condom here, it tells you, like on the box. So this has a lubricant plus STI. Well, no, that's kind of STI. Maybe this one doesn't. Maybe this just has a lubricant. There you go. This one does not have a spermicidal jelly. It has just lubricant. So this is really only just one type of protection. Are you with me? When are we done? Do you guys know? 35? Just want to make sure we've got our time right here. 10:30, so 5 more minutes. Next one that we've not talked about here, this is what they call the intrauterine device. So you can see what this does is it gets implanted into the uterus. This is something that you have to have surgically implanted or put in there by your gynecologist. And what this does is it's again physically preventing the eggs from implanting in the uterus. So the egg and the sperm can still meet. They will just be prevented from implanting. Basically by the movement of these different pieces through around the uterus. There are occasions where they can cause more damage. It's not very prevalent, but it does happen. Because again, you can see that this thing is, it's got kind of these pieces that are coming off, and that's what's keeping these guys from implanting there. I don't know how long they stay in. I have to say I'm not very up on my IUDs here. I should have done some more looking. I want to say for a period of a couple of months, and then they can be taken out and reimplanted if need be. We talked already about vasectomies. So this is where they'll, again, take that vas deferens and they'll cut the ends and tie them off or put a clip over it, which, again, basically you are stopping the flow of the sperm from the testes up and out. Well, no, they can be reversed, but it's not as... what's the word I want? It doesn't always go back. There is, I think, a 40 or so % that it doesn't work. The surgery to reverse it doesn't work. Well, there is some pain, sure, because you have to have surgery. But in the long run, so this is what I had. This is what I chose. What my wife and I chose to do after we had our second kid and we knew we were going to be done. She took hormonal birth control, oral birth control for all the times until we wanted to have kids. She stopped. We had Alex. She went on again for about a year and then off again for us to have Rebecca. And then at that point we knew we were done. Okay, so now what do we want to do? Because you can keep taking the hormonal birth control, but like I said, there's risks taking it over a long, long period of time. And this is so easy. A woman can have her tubes tied. Maybe you've heard that before. So the same kind of thing where they clamp off the uterine tubes. So therefore the egg, when it's released, can't get down into the uterus, right? No sperm can get up to the egg. And these are 100%. If you have these things done, you cannot have children, right? Very, 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 very rare for you to have this surgery not work. Because again, you're physically blocking the access between these two things permanently. Okay? So, is there a little bit of pain, with the vasectomy? Sure. But a couple of days and you're fine. And you get to be everyone babies you and, I tell you that the most common time now for them to do this surgery, they advertise it now, is during March Madness. The first weekend of the NCAA tournament where you've got Thursday, Friday, Saturday, Sunday, there's 30 basketball games. Truthfully, they'll schedule a ton of these surgeries on that Thursday, and then you just didn't watch the game for a couple of days because you got to sit and you ice and all these kind of things. But yeah, it's a tough life, right? Yeah. Morning after pills. So I have those. Oh, I got so much more things here I didn't get to show you. We're running out of time here. Let me just pause this.